just dive straight in there. So as I said, I've got a special guest. She is actually the Chief Medical Officer for Next Biosciences. We're very honored to have Dr. Yvonne Holt with us. She's a doctor with a lot of qualifications. She has a MBBCH from Wits, a diploma in Pediatrics from Wits, and a diploma in Transfusion Medicine and Medical Genetics from UCT. Well, she is absolutely passionate about the cutting-edge technology the company is involved with and describes the tech as the best that the world can offer. And what a privilege to bring this to Africa. Welcome, Dr. Yvonne. Are you there?
Yes, hi.
Let me get you in there.
Thank you very much.
There you are. Yeah, welcome. How are you doing today?
Thank you very much. Fine, good, busy.
Good.
As usual.
Yeah, but thank you so much for making time to engage with our audience. And let's just dive straight in there. So we're talking about cord blood and about all the beautiful things that we need to know that cord blood can do. Why is cord blood so amazing, and why should it never go to waste?
So let me begin with a little bit of history. It was in the 1950s, 1960s that they actually perfected bone marrow transplantation. So they managed to take bone marrow from one person and give it to another person that had a bone marrow disease, either a bone marrow cancer or a genetic bone marrow disease. And essentially their bone marrow wasn't working like it should, and it needed to be replaced. So they managed to do this bone marrow transplant. And in doing that, they discovered that these cells called stem cells within the bone marrow, and that was what, if they took bone marrow from one person, took these stem cells, put it in someone else, these stem cells regenerated a bone marrow. And they were called hemopoietic stem cells. Heme meaning blood, poietic meaning to form. So blood-forming stem cells were found in the bone marrow, and that is how they managed to regrow a bone marrow in a recipient. Then with time, scientists discovered that cord blood in the placenta of a newborn baby contained large amounts of these hemopoietic stem cells. And so they tried to take these hemopoietic stem cells and transplant them to see if they would form a bone marrow in a recipient. And they did. 1988, they did the first cord blood transplant between a brother and a sister in France, which was very successful. So cord blood contains these hemopoietic stem cells that are very useful in bone marrow transplantation.
Right. Are you still there with us?
Yeah, I am. I look frozen on my screen.
Yeah, you do look frozen on my side, but I can hear you very well. So I don't know if it's the bad connection. We can hear you perfectly fine.
Yeah.
Okay, I can see you moving again. Right. Yes, great.
Great.
Okay, so that was a great discovery.
Yeah, so and essentially that is why then scientists said, look, don't throw the cord blood away. If you keep it, we could use it to treat bone marrow disorders. And the issue is finding bone marrow donors around the world is difficult. So if we could bank this cord blood, which is thrown away anyway, we could perhaps have more opportunity to do bone marrow transplants in patients.
Right, so that is, let me get in there. That's very important to know. So, from those cells in the cord blood, you can actually prevent diseases later on in life, right? And there are a lot of applications for that. Maybe you can
So it's
tell us a
not to
little.
prevent. Yes. So what's important is for people to understand it's not the prevention of disease, it's really for treatment of disease. And how these stem cells are used, they are used for as in a bone marrow transplant. So if you have a leukemia or a lymphoma, the bone marrow in your body needs to be completely eradicated, and this is done through chemotherapy. The patient is given chemotherapy to kill all that bone marrow that is diseased. But you can't live without a bone marrow. So that is why then you need to receive a bone marrow transplant and receive these stem cells that will regenerate the bone marrow in your body so that you can continue to live. Now, what is important to understand for parents is that the diseases that affect the bone marrow are very rare. It doesn't happen commonly. And so therefore it's very difficult to tell parents that they have to store stem cells because these diseases are rare. The uses they are for life-threatening diseases and are necessary to treat these life-threatening diseases, but they are very rare. So that must always be kept in mind. We have families where the older brother or sister suffer from either a genetic blood disorder or they have been diagnosed with cancer. And if a younger sibling is born, then that child's stem cells are very useful to store to perhaps treat the older sibling. So, in those kinds of cases, that is very important. If there is a family history of any blood disorders or blood bone marrow related cancers, then it is a good idea to store the baby stem cells in those instances. Because obviously, the storage of stem cells is expensive. So, and as a doctor, we've always said that it shouldn't a young couple shouldn't give up buying a fridge for their house to store stem cells. So it has to be if the couple can afford it and if they have specific indications within their family.
Right. So thank you for that information. It's really good to understand that it can treat diseases. It's not for the prevention of it. And then also for some applications. Can you tell us then a little bit more about the cost, because you were talking about the cost for couples, and if people would now that they're informed, consider stem cell banking, would you advise them to first get some screening done if there are any genetic diseases in their family, and then they are more informed, can make an informed decision? How do you guys go about it?
Yeah, so there are no genetic screening is vast. So it's more people who you'll have a history, you'll have a family history, and so there's no screening beforehand. There is we just have educational material for parents on our website, video that is often played at antenatal classes, although I know in the last 2 years with COVID, There were not many in-person and antenatal classes. So there is no screening. It's really more around the education of stem cells, why they are important, what they can exactly be used for. One thing that I didn't mention is the innovation of the use of stem cells now in the treatment of cerebral palsy and autism. There is a lot of work being done in the US and other parts of the world using cord blood stem cells in patients with cerebral palsy. So, if the difficulty here is that you do not know if your child has cerebral palsy until the child is born and has grown a few months. But if you happen to have used or saved the baby's stem cells, there are trials now where they would reinfuse those stem cells into the child 3 or 4 months down the line, and there have been some really encouraging results where the motor function, so the movement of a child with cerebral palsy, has definitely improved. It will never cure the cerebral palsy completely, but it will certainly improve function and help help the child develop better, should I say, and live a better quality of life. So, and also it helps with talking. So that is another use of cord blood stem cells. Now, the cost of storing stem cells. Sorry, can you hear me?
Yes, carry on.
Yes. So the cost of stem cells is anything between 25,000 rand and about just over 30,000, depending on how many years you want to store the stem cells for. We have like a storage plan for 10, 15, and 20 years. The reason being is the number of cord blood stem cells that are collected is always checked before storage. Sometimes during the birth, there isn't, you need to actually collect a good volume of blood to have a good number of cells to facilitate a good bone marrow transplant. If there aren't enough cells, then it may not be worth storing. Now, the number of cells for the bone marrow transplant that are needed are calculated per kilogram of the patient. So obviously, the smaller volumes of stem cells that are collected will only be useful in children. Other ones, if there's a bigger volume, they can then be used in adults. So that's why at birth it is very important to collect a good volume of cord blood. And our company will always test and count the number of cells and the amount of blood that has been collected prior to storage. We do have a certain cutoff, and if there aren't enough cells to store, we do speak to parents and counsel them on whether it's worth storing or not. And if it is decided that it is not worth storing the sample, then they will be fully refunded for that sample, and the sample will be destroyed. So it is important to collect a good volume and a good number of cells.
Okay, great. So that brings me actually to the next point that I was wanting to ask you. Obviously, we know now how amazing the cord blood is and the stem cells. We at Sister Lillian Center in Sensitive Midwifery, we really are quite advocating delayed cord clamping because that amazing blood should be in the baby. it should definitely not go to waste. We've agreed on that. So how can that then be done? Can we still have delayed cord clamping and stem cell banking, or what is your education to parents on that one?
So delayed cord clamping is extremely important. I think any pediatrician would recommend it. So now we had to, decide. As I said earlier, you need a good volume of stem cells to store. If you do delayed clamping for a longer period of time, then you may not have enough blood to store. According to the American College of Obstetrics and Gynecologists, in agreement with their pediatric college, they have said that in a child, a baby that is over 37 weeks gestation, so it's really a full term baby. And I would imagine at that stage, that would mean at least the child would be over 2.5 to over 3 kilos. So it's a good full term baby. That delayed clamping of up to 1 minute, so 60 seconds, would be adequate, and that would then allow you to collect a good volume of stem cells. If you do go over that minute and you may not, the baby's circulation has started already and it will have taken up a lot of the cord blood in the placenta, then you may not necessarily get a good volume of stem cells collected. So we do give parents this information, and it's important that they then decide for themselves which way to go,
Sure.
because there really is, it's not worth storing a very small amount of stem cells. You won't be able to do much with it, and then you're just really wasting your money. And particularly in premature babies, and we've spoken to our gynaes as well, prem babies need their cord blood to prevent the need for blood transfusions, which are never ideal in a neonate. It also prevents intracranial hemorrhages and such. So if it is a prem baby and they need to do they will do delayed cord clamping, then it probably is not advisable to collect stem cells. So that is all in our informed consent to parents. It's on our website, and if they phone us, that is how we counsel them.
Okay, that is clear. Thank you for pointing that out, and the importance to have a good volume, a good amount, and also sort of the cutoff. So for premature babies, it's definitely not advised. And that is something that you probably never know before the time, because a prem baby is never planned. But that you can, at a moment, then have to decide we're not doing the stem cell banking. So this is some really helpful information, I think, to help.
And it also depends.
Yeah.
Yeah. So what I wanted to say, it is very often something that you have to decide at the time of the birth. You also have to check your prem baby. Sometimes the prems are a good sized baby and there are no complications. So they could have a shorter delayed clamping time, and then you may be able to collect stem cells. But very prems, if you see the baby is small, if the placenta is small, then it's not worth it. It's rather better to have the cord blood in the child. So Nevertheless, even if they decide to collect the stem cells, as I said, we do count before storage so that we tell the parents exactly how much they are storing and if it is worth continuing to store. That is very important.
Great. Yes. So this is also probably important information for the healthcare workers out there that they are aware of that in the decision making, because they are there right at the time, I can imagine. Dr. Yvonne, is there anything specific that you think that you would like expecting mothers to know, that you feel like this is my core message for this talk?
So the core message is that we have technology available to be able to store stem cells for regenerative medicine. And definitely regenerative medicine is part of future medicine, future ways of treating certain illnesses. So they are most certainly valuable. However, it is expensive to store. And so that's why I always stress that people look at their financial situation before making this decision, and not feeling guilty for not doing it because it was too expensive at the time. There are other sources of stem cells within the body that can be harvested later on in life. These stem cells from the cord blood are wonderful cells. They have wonderful regenerative power. So certainly, if it is affordable, it is worth storing. And there is a lot of work that is being done with it continuously. So perhaps when your children are adults, there will be more therapies available.
Great. I was also being made aware of your company that
That's
there's an option of private and community banking. Would you like to explain us a little bit how that works and what the difference is?
Yes. So our private bank started 16 years ago, 2005, and that is basically you pay the fee, as I said, of about 25,000 Rand for, say, 10 years of storage of that cord blood unit, and it's exclusive for your family. However, over these years, we've always wanted to work with the government to open a public stem cell bank, which means that anybody can donate their cord blood at the birth of their baby to the public bank. But that would have to be government funded. Nevertheless, our government unfortunately has other health priorities than building this public bank. So we decided with the South African Bone Marrow Registry to create what we call a community bank, where the parents, at a much reduced cost, can store their baby's stem cells. But what we do is we put that unit also on the South African Bone Marrow Registry. And we tissue type it. So we know that what tissue type it is. And if the Bone Marrow Registry has a patient who needs those stem cells, then those stem cells will become available to that patient. The family then lose those stem cells, but are refunded their money completely. So they don't, although they have paid upfront to allow these stem cells to be on the registry, if they are used by the registry, they then get their money back, so they don't lose. If they are not used by the registry, we just continue storing those stem cells for that family. So that's how we've it's a little bit of a public-private partnership just to be able to make more cord blood units available to the broader community, because out there are kids with leukemias, lymphomas, genetic blood disorders that do not have stem cells stored or were not able to afford stem cell storage and the treatment.
Wonderful. Okay, that's a great midway that you found there. I love that partnership. So, lastly, I was just wondering if do you have any testimonies, like a feel good story of families and babies that has been helped by doing this?
Yes. So I can't, I'm unfortunately not allowed to elaborate. A
Of
lot of
course.
the families do not like us to discuss details. But two families that are happy that we have published stories on were actually people who went to the US. They both had children with cerebral palsy, and at Duke University in North Carolina, they went with their stem cells. We shipped the stem cells from here to there. They were infused in the US. It's not a complicated procedure, but that's where the trial was being done, and so that's why it was done there. And three, now maybe even 4 years later, these children have much improved functioning, both motor skills and verbal skills. So those were two good success stories. And then we've had a couple with blood disorders, genetic disorders that were treated. And things like, sickle cell anemia. There's a lot of sickle cell anemia, definitely in West and Central Africa. But because of migration, we do get patients here in South Africa with sickle cell disease. I'm sure you may have heard of thalassemia. Thalassemia is another genetic blood disorder. Then Fanconi's anemia. So they are rare genetic disorders, but they do occur, and those are all the things that cord blood can be used for. And
Great.
then with
Yeah,
then also we have another. Oh, sorry, I just want to tell you about our other CSI program, which maybe some of the midwives may come across some cases. So
go for it.
our corporate social investment program is where we store for any patients in the government sector that have a leukemia or a lymphoma, and they are in need of a stem cell transplant and they cannot find a match. If they have a sibling that is being born, we will store that cord blood for free for that patient, and then see if the brother, if the siblings are a match, and then the cord blood can be transplanted to treat that older child. So we do have that program on which we run with the government's pediatric oncology units.
Wonderful. Yvonne, if midwives or mothers or fathers or to be want to find out more about your products and how to go about it to apply for this stem cell banking, where should I go and what would be the procedures?
So the best would be to contact us on 011 697 2900, or you can look at our website, which is www.nextbio.co.za. All the
Awesome.
information will be on there, including all the other products and services that we offer.
Fantastic. I'll put those the website as well as the telephone number in the show notes and in the comment as well. So if you want to find out more, reach out to Next Biobank. So it was really very informative. I'm sure there's a lot of education that needs to be done. There's forever new mothers, new fathers that are appearing and that has not had this knowledge of stem cells. So thank you for informing us on the absolute amazingness of cord blood and stem cells and what is all possible in medicine. I really, really appreciate your time.
It's a pleasure. It's a pleasure. Thank you for having me.
All right. I think for last to finish off, I'm going to show one more clip of from you guys that I've received. It's also just some extra information. So we're wishing you a beautiful day, Dr. Yvonne, and all the best of the beautiful work you do.
This is Sarah. She's busy discovering life like any other healthy, happy little 3-year-old. But Sarah's future, like any child's, is not 100% certain. Sarah's parents explored a number of options available to them at Sarah's birth and were very happy that their gynecologist had made them aware of stem cell banking to help safeguard Sarah's future health. Stem cell banking is a form of medical insurance and gives parents the opportunity to bank their baby's umbilical cord blood and tissue stem cells at birth for potential future medical use. A baby's umbilical cord is normally discarded as medical waste. However, parents have the opportunity to collect this valuable source of stem cells at birth. These stem cells are biologically younger than cells collected later in life and have a better regenerative potential. Why should you bank your baby's cord blood? The hematopoietic blood-forming stem cells found in your baby's cord blood are currently being used to treat over 80 blood-related diseases. They are used in transplants to regenerate bone marrow, treating diseases such as leukemia, lymphoma, thalassemia, Fanconi's anemia, and sickle cell anemia. How does it work? Cord blood is collected in a blood bag immediately after the birth of your baby by your gynecologist or midwife. This is a safe, quick, and painless procedure. The cord blood is a 100% match for your baby, and there is a 25% chance of it being a match for a sibling. Why should you bank your baby's cord tissue? The mesenchymal stem cells found in your baby's cord tissue give rise to the connective tissues of the body, such as your skin, bone, nerves, cartilage, and fat. These stem cells are currently in the clinical trial phase, with research focused on treating a huge variety of conditions, such as muscle and bone injury, autoimmune disease, heart disease, diabetes, neurological disease, spinal cord injury, wound healing, and bone marrow transplant complications. How does it work? After the cord blood is collected and the placenta is delivered, a piece of cord tissue is collected and placed in the container provided. Sarah's gynecologist explained how easy it was to register for stem cell banking with NetCells, with an easy online registration on the NetCells website. They met with a NetCells consultant who personally handed over the NetCells collection kit. They explained everything to Sarah's mom and dad. When it was time for Sarah to be born, her father ensured he took the NetCells collection kit along to the hospital. When they arrived at the hospital, Sarah's parents reminded their gynecologist that they were going to collect Sarah's stem cells. Once Sarah was safely born, their gynecologist collected the stem cells from the umbilical cord. It only took a few minutes. A phlebotomist came to take Sarah's mom's blood when she was back in the maternity ward so that it could be tested for any transmissible diseases. Sarah's parents completed the documentation and ensured that everything had been packaged correctly by following the checklist in the kit. They called the NetCells consultant to arrange the courier of Sarah's stem cells to the NetCells laboratory for processing. Once processed, Sarah's stem cells were cryogenically frozen and stored in large specialized tanks. They remain in these tanks until they are needed. Sarah's mom and dad were issued with the results and storage certificate. Today, NetCell's stem cell banking continues to help ensure my future. My future has a chance at a happy ending. Make sure your child's does too. If you are expecting a baby or planning to have a family, please speak to your gynecologist or midwife about banking your baby's stem cells with NetCells. NetCells is internationally accredited by the AABB and also has ISO accreditation for your peace of mind. Make them your choice. Invest in your family's future health with NetCells.
So that was us for today's live show. Hope you enjoyed that and learned loads. We will see you next week. And remember, if you want to know more about NetCells and stem cell banking, go to the website www.bionext.co.za. Have a lovely rest of your day. Bye.